My name's Patrick Burnett. I'm the Chief Medical Officer at Arcutis Biotherapeutics and a dermatologist. For our sNDA that we just submitted for Zoryve cream 0.05% to the FDA, the primary data that underlies this is coming from the INTEGUMENT-INFANT trial, which is a study where we treated open label. We had about 101 infants ages 3 to 24 months of age with mild to moderate atopic dermatitis. And there we looked at the safety and efficacy in this open label trial over a 4-week treatment period. And I think some of the key takeaways, first starting with the safety data, this 0.05% cream is already approved for ages 2 to 5. So we know what the safety data look like. And the data from this INTEGUMENT-INFANT trial looked pretty similar to what we would have expected based on our kind of approved previous studies. So there, the most common adverse events were including diarrhea, nasopharyngitis, upper respiratory tract infection, and then a lower rate of vomiting. But importantly, I think it's important to keep in mind the age of the patients that we're talking about here, right? These are infants 3 to 24 months of age. Now, when we look at the efficacy data, we had a couple of endpoints that we were really interested in talking about. First of all, if we just think about IGA success, about a third of patients got to clear or almost clear, and a 2-step improvement. That's IGA success over that 4-week period. But as we think about endpoints that probably clinicians are more connected with, EASI-75 jumps to mind. And there we had 58% of patients who got to a 75% improvement in their atopic dermatitis by the time they reached week 4. And one of the things that was released when we presented the data at the American Academy of Dermatology was talking about improvement in scalp. And that's, I think, an underrepresented part of these patients' disease experience. And they're around 2/3 of patients, so 67.5% of patients who came in with at least mild baseline scalp involvement made it to a VIGA AD scalp success at week 4. So I think that was, for us, really interesting to be able to show that these younger patients who get scalp involvement, that we're able to really impact that. And then I think just the last piece, because the impact of symptoms is so important for patient experience. When we're talking about these little kids, they can't really tell you exactly what's going on with their itch. So we had to ask the caregivers. And here we took a slightly different approach as well. We used something called a dynamic pruritus score, where we looked at different time points, including as early as 10 minutes. And we asked the caregivers, what percentage improvement from before you put on the treatment, before you put on the Roflumilast cream, did you see in the patient's itch as you're observing them? And so if we look at a 25% improvement in itch by 10 minutes after, just the first 10 minutes after applying Roflumilast cream, we saw that almost half, 46.6% of patients had a 25% improvement within that time period. And I think that that really starts to help us to understand just how quickly that this is working in the skin. So we were excited to get all of these data to the FDA for their review to potentially have the 0.05% extended down to the age of 3 months. As we think about formulation for patients with atopic dermatitis, and as we move earlier and earlier down this age ladder, so we're already approved with the 0.05% cream for ages 2 and above, but as we move into these earlier ages, all the way down to 3 months, this is a time period where not only is the immune system evolving and maturing through that time period, but also the skin itself is undergoing changes and maturation during this time. So these patients tend to be very, very sensitive. So it becomes even more important to have a formulation such as what we have for Zoryve cream that doesn't contain any sensitizing excipients, things like propylene glycol, polyethylene glycol, ethanol, or fragrances. This is always a big part of counseling patients when you're just talking about an atopic dermatitis infant. What is it that the parents might need to avoid? We're always asking them to watch out for fragrances, even if they might be on the parent themselves and not applied to the child. So this is going to be very much in line with what it is, the education that healthcare providers are giving to their young AD patients' caregivers. We hear a lot from caregivers and from healthcare providers who are taking care of these patients about steroid phobia. And I think that that comes back to the fact that in this young age group, there really is only a handful of topical treatments that are approved, and the majority of those are different formulations of topical steroids. A lot of the options that are being offered tend to include a topical steroid. And I think the biggest concern there, as we talk to healthcare providers, is really about the long-term treatment. I think the ability to manage a patient who's in the middle of a flare and to get short-term control is one where people feel pretty comfortable treating with a topical steroid. But atopic dermatitis is a disease that this patient is going to have for an extended period of time, typically for years and oftentimes for their entire life. So then it really becomes about, okay, how can a treatment be identified that's good for long-term management of this chronic disease? And that's where having an effective, well-tolerated treatment option that's easily included into a patient's daily regimen. And something as easy as just having once daily application is really important, because then you just have to find that one window a day where it can be incorporated into the care regimen, and not have to think about how to get another opportunity later in the day. People are very busy, especially if they're trying to take care of an infant with atopic dermatitis. So we think that the aspects and the profile of Zoryve cream really fits well for what healthcare providers and patients are looking for as that long-term treatment option that doesn't include a steroid. As a member of or fellow of the American Academy of Dermatology, I was really excited to see that they had released guidelines for pediatric atopic dermatitis. And here, the AAD's strong recommendation for Zoryve cream reflects the high certainty of evidence. And that's, I think, one of the pieces of these guidelines that is really important, is that these are rigorously performed and they really look very carefully at the data and the evidence supporting treatment. And I think the low rates of treatment discontinuation and the favorable tolerability profile really played into that strong recommendation for Zoryve in these guidelines. I think that this really supports a non-steroidal treatment option for chronic treatment of patients with atopic dermatitis, which is something that I know many of the members of the American Academy of Dermatology are looking for. And just kind of like harkening back to this idea that even though we're talking about pediatric atopic dermatitis here, this is a therapy that is something that patients are looking for to treat their disease long term. And it's important to really have a strong balance between the efficacy and the long-term safety and tolerability. I believe there really has been a surge in the amount of regulatory approvals for pediatric indications. And as someone who's been in dermatology and witnessing this kind of expansion of the number of treatment options that are specifically approved for a lot of the inflammatory diseases that we're taking care of, it is fantastic to now see them starting to move earlier into treatment, where oftentimes we've had really limited access for patients to innovative treatments. I really believe that it is kind of a progression of this like wave of interest in innovative treatments, especially in the topical area. I think it was probably maybe 5 or 10 years ago we started to see some more systemic options. But keeping in mind that the vast majority of patients have mild to moderate disease, as we're talking about, these common inflammatory diseases like our Zoryve is approved for, and then even as patients might move into systemic therapy, sometimes they have residual disease. So, I believe that this is a really important advancement, and it reflects, I think, the strong support for dermatology and for pediatric diseases within industry. So despite the wave of approvals coming through for many of the pediatric diseases and kind of advancing some of these therapies earlier, I do think that there still is quite a bit of unmet need in pediatric dermatological diseases. So if we just think about inflammatory skin diseases, and at Arcutis, we've really been pushing to try and advance these therapies in those common inflammatory chronic skin diseases like atopic dermatitis, which we've just been talking about, seborrheic dermatitis, where a foam is approved all the way down to the age of 9 already, which is really the earliest onset that you see seborrheic dermatitis, and then psoriasis, where we have a PDUFA for cream 0.3% to move all the way down to the age of 2 there in late June of this year. So if you think about that, those are some of the most common diseases, inflammatory skin diseases that walk into a dermatologist or a pediatric dermatologist's office. But where I would also really like to see something is in acne. We see a ton of acne patients, and oftentimes we're using treatments that have been around for many decades, and we haven't seen much innovation in the treatment of acne. And so I think those patients really face a challenge. So where I'd like to challenge everyone, including Arcutis, is to see if we can't find something to help out all of our patients with acne, which is a very, very common skin disease that can sometimes lead to scarring. And we see that a lot in the pediatric population.